Familial Mediterranean fever (FMF), also known as periodic peritonitis, familial paroxysmal polycerositis, periodic disease, Siegel-Catton-Mamu disease, Wolff periodic disease, or Riemann syndrome, is an autoinflammatory genetic disorder that causes recurrent fevers and serosal inflammation of the abdomen, lungs, and joints leading to severe pain. 1. The first attack frequently occurs in childhood, and it usually begins before the age of 20 years. All attacks develop over 2 to 4 hours and last anywhere from 6 hours to 4 days. Sometimes it is accompanied by a rash or headache. This hereditary disease represents the most common of the periodic fever syndromes and is named FMF because it mainly affects the people of Mediterranean and Middle Eastern origin. Pyrin, 781 amino acid protein, is believed to be involved in the pathophysiology of FMF. Pyrin is mainly found in the cytoskeleton of the circulation cells, including the white blood cells. White blood cells are responsible for mounting an immune response to pathogens. The exact structure and function of pyrin protein and its role in creating an inflammatory response in FMF are still not completely understood. One central hypothesis is that the pyrin binds to an apoptosis-associated speck-like protein ASC and caspase-1. This inhibits activation of IL-1 beta interleukin, and hence the inflammatory pathways. Mutation of MEFV genes disrupts pyrin protein and its function, which leads to activation of IL-1 beta and then the entire inflammatory pathway. Fever is the most common and sometimes the only symptom, especially during childhood, to occur during FMF attacks. Chest pain. The involvement of pleura leads to the development of chest pain, which is mostly unilateral and worse with deep inspiration or coughing. Joint pain. Arthralgia is common in non-Ashkenazi Jews. Large joints of lower extremities are mostly affected, including hip, knee or ankle joints. Other symptoms: erysipelas-like lesion, scrotal swelling, and myalgia.